Some encouraging news in the fight against COVID.
Today, the White House is announcing plans to make a COVID pill for treating the virus available to millions more Americans.
The news comes as 31 states are seeing an uptick in COVID cases, including Wisconsin. UW Health's Chief Quality Officer, Dr. Jeff Pothof, back with us on his Tuesday visit.
Hello,
Thanks
Dr. Pothof.
Good to be with you guys.
So let's talk about this drug. It's
Paxlovid.
Paxlovid, and it treats COVID symptoms.
Yeah, it actually prevents you from getting really sick from COVID. So it's two drugs mixed into one. What you want to do is you want to test positive and start this medication within the first 5 days. And if you have some features that make you high risk, whether it's obesity or other things, you're eligible for this medication. And I feel like a lot of people maybe aren't aware of this. Early on, it was really scarce. So there was allocations, you couldn't always get it. Now that's starting to change. So if you do come down with COVID and you have some features that make you think you might have severe disease, call your doctor and see if you're eligible. There are a lot of drug-drug interactions, so you got to check those. But outside of that, it's a really good idea.
Prescription.
How does it work?
Yeah, so it messes up the virus's ability to kind of replicate itself, kind of screws that up a little bit so that you don't get these high viral concentrations, and that leads to less severe disease, less likely to be hospitalized, less likely to be on a ventilator. And that's what's nice about this drug. It doesn't necessarily make your symptoms feel better. You might still feel like you got hit by a train, but you're less likely to come see me in the emergency department. You're less likely to be admitted.
And we're seeing numbers on the rise, including the vice president today, Kamala Harris, announcing that she's double vaccinated, double boosted.
No symptoms.
No symptoms. So this virus is getting in, but you're not getting sick necessarily, sick.
Yeah, I think there's two stories there. One, this virus, every time it mutates, it gets more and more contagious. So it's hard to really, overstate just how easy it is to catch COVID, especially folks like Vice President Harris, who's kind of in a bubble, still got it. And then likewise, vaccinated, boosted, we don't see severe disease hardly at all in people who have chosen to get that protection. So you might get symptoms. It might be kind of a fly in your jam, but you're not spending time in the hospital. It's not really disruptive.
The CDC said today that the number of Americans who have not had COVID are now in the minority in the country. So are we talking about some kind of herd immunity here, or is it just people that have been vaccinated who may have had it and never known unless they were testing for it?
Yeah, so not so much herd immunity, but where this can be helpful, and what our hypothesis is currently is between the individuals who've been vaccinated, boosted, and the rest of everyone who've likely come in contact with COVID-19 and have some immunity, they may get symptoms. Our immunity is not so good to prevent symptoms, but it may prevent severe disease. And that's why we're hoping, fingers crossed, that with the cases increasing, what we won't see this time that we've seen every other time is an increase in hospitalizations. And that would be great, because we can probably tolerate a fair number of cases as long as we're not overwhelming healthcare systems. Everyone can get the healthcare that they need. And that might be because most of us have come in contact with COVID already.
We were talking before we went on there. I said, well, I've been lucky. I haven't gotten COVID. And you go, how do you know?
Right.
You don't know unless you're testing regularly.
Right.
Yeah.
Right. Exactly. I mean, a lot of us, especially those who are vaccinated, we may have had, a symptom that we blew off, and that was COVID for us, and we would never know that we came in contact with COVID. Other folks who had mild disease just never registered. So the percent of people who have had COVID is probably higher than the number of people who've had a positive test.
We've probably been exposed, all of us.
I think if you haven't been exposed, it's going to happen. This idea that you're going to avoid coming in contact with COVID, that's not going to happen.
That's over now.
That's done.
Is there any update on vaccinations for children under 5?
I haven't heard, which, I kind of thought we'd be in this place where we'd be getting news kind of, the end of April, early May, and I haven't heard. So I imagine the next few weeks we should hear something from Moderna or Pfizer on the under 5s, especially as cases go up. I know there's a lot of parents that would love to get their kids protected.
Oh, but this new medication, I mean, that's a big game changer.
Paxlovid is something to be aware of. If you come down with COVID, you've got some risk factors. I would definitely be on the horn with my physician saying, hey, is this something that I should be thinking of? Because it's more available now.
That's a good advice.
Doctor, thanks for being with us.
Great to see you.
See you next week.